Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
The nurse is planning to teach a client with chronic obstructive pulmonary disease how to cough effectively. Which of the following instructions should be included? 1. Take a deep abdominal breath, bend forward, and cough 3 or 4 times on exhalation. 2. Lie flat on the back, splint the thorax, take 2 deep breaths, and cough. 3. Take several rapid, shallow breaths and then cough forcefully. 4. Assume a side-lying position, extend the arm over the head, and alternate deep breathing with coughing. The correct answer is 1. The goal of effective coughing is to conserve energy, facilitate removal of secretions, and minimize airway collapse. The client should assume a sitting position with feet on the floor if possible. The client should bend forward slightly and, using pursed lip breathing, exhale. After resuming an upright position, the client should use abdominal breathing to slowly and deeply inhale. After repeating this process 3 or 4 times, the client should take a deep abdominal breath, bend forward, and cough 3 or 4 times upon exhalation. Lying flat does not enhance lung expansion. Sitting upright promotes full expansion of thorax. Shallow breathing does not facilitate removal of secretions, and forceful coughing promotes collapse of airways. A side-lying position does not allow for adequate chest expansion to promote deep breathing. When instructing clients on how to decrease the risk of chronic obstructive pulmonary disease, the nurse should emphasize which of the following? 1. Participate regularly in aerobic exercises. 2. Maintain a high-protein diet. 3. Avoid exposure to people with known respiratory infections. 4. Abstain from cigarette smoking. The correct answer is 4. Cigarette smoking is the primary cause of COPD. Other risk factors include exposure to environmental pollutants and chronic asthma. Participating in an aerobic exercise program, although beneficial, will not decrease the risk of COPD. Insufficient protein intake and exposure to people with respiratory infections do not increase the risk of COPD. One of the important aspects of the client's rights is the right to treatment in the least restrictive environment. The nurse observes this principle when making which decisions? Select all that apply. 1. Referring a client to a group home or supervised apartment living. 2. Releasing client information to a primary care physician or a relative. 3. Placing a client in seclusion or restraints. 4. Respecting the client's right to accept or refuse treatment. 5. Placing a committed client in a daily outpatient group or a weekly self-help group. The correct answers are 1, 3, and 5. Group homes, apartment programs, seclusion, restraints, day treatment programs, and self-help groups all involve degrees of restriction and supervision. Releasing information about the client is governed by legislation and rules of confidentiality. Accepting or refusing treatment is governed by laws related to informed consent. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Rationale. The loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. At 38 weeks gestation, a prima gravida client with poorly controlled diabetes and severe preeclampsia is admitted for cesarean birth. The nurse explains to the client that childbirth helps to prevent which of the following? 1. Neonatal hyperbilirubinemia. 2. Congenital anomalies. 3. Perinatal asphyxia. 4. Stillbirth. The correct answer is 4. Stillbirths caused by placental insufficiency occur with increased frequency in women with diabetes and severe preeclampsia. Clients with poorly controlled diabetes may experience unanticipated stillbirth as a result of premature aging of the placenta. Therefore, labor is commonly induced in these clients before term. If induction of labor fails, a cesarean section is necessary. Induction and cesarean section do not prevent neonatal hyperbilirubinemia, congenital anomalies, or perinatal asphyxia. A prima gravida client at 34 weeks gestation is experiencing contractions every 3 to 4 minutes, lasting for 35 seconds. Her cervix is 2 centimeters dilated and 50% effaced. While the nurse is assessing the client's vital signs, the client says, "I think my bag of water just broke." Which of the following would the nurse do first? 1. Check the status of the fetal heart rate. 2. Turn the client to her right side. 3. Test the leaking fluid with nitrazine paper. 4. Perform a sterile vaginal examination. The correct answer is 1. The priority is to determine whether a prolapsed cord has occurred as a result of the spontaneous rupture of membranes. The nurse's first action should be to check the status of the fetal heart rate. Complications of premature rupture of the membranes include a prolapsed cord or increased pressure on the fetal umbilical cord, inhibiting fetal nutrient supply. Variable decelerations or fetal bradycardia may be seen on the external fetal monitor. The cord also may be visible. Turning the client to her right side is not necessary. If the cord does prolapse, the client should be placed in a kneaded chest or Trendelenburg position. Checking the fluid with nitrazine paper and vaginal examination are appropriate once the status of the fetus has been evaluated. A nurse is discussing preterm labor in a prenatal class. After class, a client and her partner ask the nurse to identify again the nursing strategies to prevent preterm labor. The clients need further instruction when they state which of the following? 1. I need to stay hydrated all the time. 2. I need to avoid any infections. 3. I should include frequent rest breaks if we travel. 4. Changing to filter cigarettes is helpful. The correct answer is 4. Smoking in any form is contraindicated in pregnancy, regardless of the type of filtering system used. Smoking is a major risk factor for preterm labor and decreased fetal weight. Dehydration is a risk factor for preterm labor, as is prolonged standing and remaining in one position. Infection is thought to be a primary cause of preterm labor, and the client would need to avoid contracting any type of infection. While taking trips, frequent emptying of the bladder prevents infection and ambulates the woman. Which of the following actions indicates that the parents of a 12-month-old with iron deficiency anemia understand how to administer iron supplements? Select all that apply. 1. They administer iron supplements in combination with fruit juice. 2. They administer iron supplements with meals. 3. They report dark stools. 4. They brush the child's teeth after administering the iron supplements. 5. They decrease dietary intake of foods fortified with iron. The correct answers are 1 and 4. Parent teaching concerning a child with iron deficiency anemia should include directions about giving iron combined with fruit juice in divided doses between meals and with a dropper for a 12-month-old or through a straw for older toddlers. Iron stains teeth, so brushing the teeth and administering liquid iron through a dropper or straw are necessary to prevent staining the teeth. Iron should not be given with milk and tacids or tea and should be administered on an empty stomach. Iron will cause the stool to become black or green, which is normal and does not need to be reported. However, light-colored stools indicate the iron is not being absorbed and should be reported. The primary health care provider prescribes pulse assessments through the night for a 12-year-old child with rheumatic fever who has a daytime heart rate of 120. The nurse explains to the mother that this is to evaluate if the elevated heart rate is caused by 1. The morning digitalis. 2. Normal activity during waking hours. 3. A warmer daytime environment. 4. Normal variations in day and evening hours. The correct answer is 2. An above-average pulse rate that is out of proportion to the degree of activity is an early sign of heart failure in a client with rheumatic fever. The sleeping pulse is used to determine whether the mild tachycardia persists during sleep or whether it is a result of daytime activities. The environmental temperature would need to be quite warmer before it could influence the heart rate. Digitalis lowers the heart rate, so the rate would be decreased during the daytime. Which of the following is an expected outcome for an adult client with well-controlled asthma? 1. Chest X-ray demonstrates minimal hyperinflation. 2. Temperature remains lower than 100 degrees Fahrenheit. 3. Arterial blood gas analysis demonstrates a decrease in PO2. 4. Breath sounds are clear. The correct answer is 4. Between attacks, breath sound should be clear on auscultation with good airflow present throughout lung fields. Chest X-rays should be normal. The client should remain afebrile. Arterial blood gases should be normal. The nurse administers theophylline to a client. When evaluating the effectiveness of this medication, the nurse should assess the client for which of the following? 1. Suppression of the client's respiratory infection. 2. Decrease in bronchial secretions. 3. Less difficulty breathing. 4. Thinning of tenacious, purulent sputum. The correct answer is 3. Theophylline is a bronchodilator that is administered to relax airways and decrease dyspnea. Theophylline is not used to treat infections and does not decrease or thin secretions. Which of the following physical assessment findings are normal for a client with advanced chronic obstructive pulmonary disease? 1. Increased anteroposterior chest diameter. 2. Underdeveloped neck muscles. 3. Collapsed neck veins. 4. Increased chest excursions with respiration. The correct answer is 1. Increased anteroposterior chest diameter is characteristic of advanced COPD. Air is trapped in the overextended alveoli, and the ribs are fixed in an inspiratory position. The result is the typical barrel-chested appearance. Overly developed, not underdeveloped, neck muscles are associated with COPD because of their increased use in the work of breathing. Distended, not collapsed, neck veins are associated with COPD as a symptom of the heart failure that the client may experience secondary to the increased workload on the heart to pump blood into the pulmonary vasculature. Diminished, not increased, chest excursion is associated with COPD. A client diagnosed with schizophrenia is being switched to risperidone long-acting injection, which is Risperdal Consta. He is told that he will remain on his oral dose of risperidone daily for approximately 1 month. The client says, "I didn't have to take pills when I was on fluphenazine decanoate shots in the past." The nurse should tell the client, 1. Taking fluphenazine orally and by injection would not be as effective as the injection alone. 2. Risperdal Consta is less potent than fluphenazine decanoate. 3. The doctor didn't believe you would take both the pills and fluphenazine decanoate. 4. Risperdal Consta initially takes a little longer to reach the ideal blood level. The correct answer is 4. Achieving a therapeutic blood level is a slower process with risperidone long-acting injection. Oral fluphenazine does not decrease the effectiveness of the intramuscular version and might increase the incidence of adverse effects. There is no evidence that the potency of the two medications is significantly different. Blaming the client for noncompliance with these two medications is inappropriate. The nurse is caring for a client with a suspected diagnosis of hypercalcemia, which sign/symptom is an indication of this electrolyte imbalance. 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. After teaching a diabetic prima gravida about symptoms of hyperglycemia and hypoglycemia, the nurse determines that the client understands the instruction when she says that hyperglycemia may be manifested by which of the following? 1. Dehydration. 2. Pallor. 3. Sweating. 4. Nervousness. The correct answer is 1. Dehydration, polyuria, fatigue, flushed hot skin, dry mouth, and drowsiness are manifestations of hyperglycemia. Hyperglycemia is a medical emergency and requires immediate action to prevent maternal and fetal mortality. Pallor, sweating, and nervousness are early signs of hypoglycemia, not hyperglycemia. A prima gravida client at 36 weeks gestation with premature rupture of the membranes is to be discharged home on bed rest with follow-up by the home health nurse. After instruction about care while at home, which of the following client statements indicates effective teaching? 1. It is permissible to douche if the fluid irritates my vaginal area. 2. I can take either a tub bath or a shower when I feel like it. 3. I should limit my fluid intake to less than 1 quart daily. 4. I should contact the doctor if my temperature is 100.4 degrees Fahrenheit or higher. The correct answer is 4. Because of the client's increased risk for infection, successful teaching is indicated when the client states that she will contact the doctor if her temperature is 100.4 degrees Fahrenheit or greater. The client should be instructed to monitor her temperature twice daily. The client should refrain from douching and tub bathing, which can increase the potential for infection. Showering is permitted because water in the shower doesn't enter the vagina and increase the risk of infection. A fluid intake of at least 2 liters daily is recommended to prevent potential urinary tract infection. The healthcare provider has determined that a preterm labor client at 34 weeks gestation has no fetal fibronectin present. Based on this finding, the nurse would anticipate that within the next week, 1. The client will develop preeclampsia. 2. The fetus will develop mature lungs. 3. The client will not develop preterm labor. 4. The fetus will not develop gestational diabetes. The correct answer is 3. The absence of fetal fibronectin in a vaginal swab between 22 and 37 weeks gestation indicates there is less than 1% risk of developing preterm labor in the next week. Fetal fibronectin is an extracellular protein normally found in fetal membranes and deciduous and has no correlation with preeclampsia, fetal lung maturation, or gestational diabetes. The mother asked the nurse why her child's hemoglobin was normal at birth, but now the child has S hemoglobin. Which of the following responses by the nurse is appropriate? 1. The placenta bars passage of the hemoglobin S from the mother to the fetus. 2. The red bone marrow does not begin to produce hemoglobin S until several months after birth. 3. Antibodies transmitted from you to the fetus provide the newborn with temporary immunity. 4. The newborn has a high concentration of fetal hemoglobin in the blood for some time after birth. The correct answer is 4. Sickle cell disease is an inherited disease that is present at birth. However, 60% to 80% of a newborn's hemoglobin is fetal hemoglobin, which has a structure different from that of hemoglobin S or hemoglobin A. Sickle cell symptoms usually occur about 4 months after birth, when hemoglobin S begins to replace the fetal hemoglobin. The gene for sickle cell disease is transmitted at the time of conception, not passed to the placenta. Some hemoglobin S is produced by the fetus near term. The fetus produces all its own hemoglobin from the earliest production in the first trimester. Passive immunity conferred by maternal antibodies is not related to sickle cell disease, but this transmission of antibodies is important to protect the infant from various infections during early infancy.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.